doctor, I find that I have to push myself extra hard, especially when faced with emergencies.
I face a lot of challenges in my everyday work. This ranges from low pay to age-based discrimination to violence and harassment in workplace.
We are underpaid, undervalued, and taken for granted.
It can be sometimes difficult to be taken less seriously by your community because you do not look old enough, and your experience might often be put in question, even in basic situations, by the patients.
The current government policies do so little in favor of young healthcare workers. The government is always in opposition against our demands.
Young healthcare providers in my country also face additional challenges. They have lack of job security. Some of them have month-to-month contracts, which means that they aren't allowed sick leave or annual leave or aren't able to plan their futures. Others face bullying and high-stress environments because they're young and they're still learning, so they depend on the more senior healthcare providers to guide them.
This is reducing our enthusiasm and our motivation as young health workers.
We demand for structural changes, including having a strong accountability mechanism, create laws and policies for the well-being, protection and support of healthcare workers.
It is imperative that global leaders understand that healthcare is a basic human right, and it is their responsibility to provide quality healthcare for their people.
To work on ensuring that the workplace is safe and devoid of harassment for young healthcare workers.
We need further education programs, trainings. We need to be provided with opportunities to develop ourselves.
We need support and encouragement to pursue leadership positions. Moreover, efforts must be put so that young healthcare professionals have safer working conditions and the active prevention of burnout.
The health workforce right now faces discrimination, poor working conditions, poor pay, little prospects, harassment, violence, and bullying. If we want to survive and thrive as a society, we need to improve our health system. And in order to do that, we must increase our investments for young healthcare professionals. This is in order to support the health system, fill the critical gaps in the workforce, and to create a strong, healthy system so we can fulfill our promise for health for all through universal health coverage.